And our next speaker is from Wilmer, Dr. Pradeep Rumulu, who's the Sheila K. West Professor of Ophthalmology, and he's director of the Glaucoma Division of Wilmer Eye Institute, Johns Hopkins. Thanks so much for coming.
Right, stay up afterwards. Just stay up a little bit. Well, thanks to all of you for joining and being with us today. And it's really wonderful to see so many people so deeply engaged in their condition and also trying to make things better for others as well at the same time. So thank you for being here. I do have some disclosures, which are shown over here. I think the first thing to mention when we're trying to say, well, how do you make your glaucoma better and how do you have a better future with glaucoma, is that I never want anybody to beat themselves up for having gotten it in the first place. I think that there's really no blame to go around. Glaucoma is a very genetic disease. In fact, of all the diseases that we can look at, it was rated as a third most genetic disease, meaning that a lot of this was going to happen to you, one way or the other, and it's not something that you could have necessarily prevented without knowing that it was coming in your direction. And I think as you get older, age-related eye disease is very, very common. So a lot of people develop age-related, eye diseases as they get older. So it's not something to really to blame yourself over. I think the goal is to try and keep it mild, and I think there's a lot that's been discussed over the last couple sessions about how we can do that. When we get glaucoma, we probably can change how bad it's going to be with our behavior. So, obviously I said that a lot of the risk that's going to happen is from your genetics. But if you took a bunch of people who had the same genetics, not all of them are going to get the disease at the same time or have it progress at the same rate. And a lot of that is going to be due to the way they behave. So the things they eat, the way how active they are, their stress levels, other things as well, probably come into play. There may be some behaviors which are extraordinarily protective. One that really stands out is being very physically active. There was a study that was done on male runners, and they looked at some male runners when they were in middle age, and they saw how many of them went on to get glaucoma. And they found that the individuals who ran faster and the ones who ran more actually did better. If at some point in your life you ran very, very fast, almost unrealistically fast for most of us in this room, 10K in 33 minutes, you never got glaucoma. People who ran more also did better. So that's one thing. You can say, well, what about the women? Actually, so few of the women runners even got glaucoma that there was no data to analyze because almost none of them actually got anything. So there is a suggestion that people who are very active can materially affect the risk of getting the disease in the first place. This is an extreme level of fitness, and it's not for everybody, especially as we get older. Sometimes these are not the exercises we can do. There is some evidence that that just being kind of on the more fit side alone is very helpful. So this was a study that was done out of Iowa State University where they actually looked at two things. They looked at, your level of physical activity, and they found that people who did just the recommended level of physical activity, as judged by kind of national organizations, were able to have the risk of getting glaucoma in the future. And if you're in the top third of fitness, which is, again, a very realistic goal for most of us, the risk of getting glaucoma in the future went down by 40%. So you don't have to be kind of a Superman or Superwoman to really avoid things. The goals for today are really to kind of give you some ideas for changes that you might make in your behaviors that can really help the trajectory of glaucoma going forwards. I want to persuade you that these are valid or important. I will say right off the bat that none of these have the highest level of evidence. Probably the only thing we have is the highest level of evidence of protecting against glaucoma is lowering your eye pressure. So make sure you see your doctor and do that. But these are things that have some evidence behind them that can supplement that activity. And I think the last thing is that, it's easy to be in here and to talk about things that you ought to be doing. It's really much harder to do it. I have to take like one medicine a day and I have to pay a lot of attention to really make that happen. So I want to make you believe that change is possible and give you some ideas about maybe how you can enact that change. The key thing to making changes is actually believing that you can change. So, this is a really nice book by Carol Dweck, a Stanford psychologist, called Mindset, where she actually describes two different types of ways that people think. And she related it to children and how children's outcomes were in terms of their education. There are people who believe that we are what we are, that we're good at what we're good at and we're bad at what we're bad at. And we never really make the effort to change because we think that what we are is already embedded in our DNA and we can't change that. And there's people who actually have what she calls a growth mindset, where they believe that their abilities can change with effort and practice. And these are individuals who, not surprisingly, are actually able to change themselves much more because they believe they can change. So I would also say the first step that you have to take is to believe that you can change yourself. For example, we actually recruited a bunch of patients who were a pretty sedentary group, and we were able to help them be fairly active afterwards. This graph shows their number of steps by week. And you can see that they started off taking about 4,000 steps per week. By the end of the study, they were up to about 8,000 steps per week. So they actually did pretty well. I was really, really happy with this result. You can say, well, what did we do to help them? There were probably two things. The first thing is that we gave them text messages, giving them a goal and encouraging them to reach that goal. We gave them a Fitbit so they can see how much they were walking. A lot of that is now on our phone. Don't even need a Fitbit. But I think what really actually helped, and this was an idea of one of our students at the time, is that she did some motivational interviewing with all the students where she actually she reflected with them about why they wanted to increase their activity. And and she met with them a couple times over the course of these 12 weeks, and she repeated those concepts back to the individual. So she said, oh, I know you were trying to really be more active because you wanted to be around for your grandkids as they go through their birthdays and graduation. How are you doing in achieving your goal? And so when you tell somebody something back, what they told you in the first place, it's actually a very powerful technique. And so I think when you think about why you want to implement some changes, make it be your own idea. Don't let me tell you to do it. Anytime something is your own idea, you're much more likely to achieve it. Can your lifestyle actually help or prevent glaucoma? And these are some ways that our lifestyle has been suggested to really be helpful for glaucoma. There's a number of treatments, a number of lifestyle changes, which may actually influence your eye pressure. I'll talk about each of these individually. We can see that some of the things that we do changes the way our body works. So it's not just a voodoo thing. It's actually changing the physiology of our body. And then there's some evidence that they may be associated with less glaucoma in the future or prevent the glaucoma. And finally, all these things also play into our systemic health. So I think the best things that we can change are things that not only affect our glaucoma, but also just generally make us more healthy, and maybe things we ought to be doing anyway. So let's talk about some things which may change your eye pressure. Marijuana came up earlier in the discussion I was having at our table. And, a lot of people say, oh, can I use marijuana? And marijuana does very potently lower eye pressure, but it only does so for a very short period of time. You can see in this graph over here that, there's a downward trend for like the first hour or two, but then by 3 hours, it's not actually working anymore. That's really only one of the problems that it has. First of all, a lot of times you don't know what the dose you're getting is. When you're taking a medicine, there's a very specific dose of that medicine that you need to take for the drug to be effective. And when you're taking something, you really don't know what dose you're getting. And unfortunately, the dose that you need to be getting is the dose that gets you high. So the same molecule that works is the same molecule that makes you high. And the dose that you need to lower your eye pressure is the dose that makes you cognitively impaired. So you can't really kind of be like a little bit on the edge and still be working it. So it's not really realistic to be high all the time. There's hundreds of other compounds that you're inhaling or eating, which may be dangerous, and we don't know that well about them. And not all products are the same. A lot of people ask about CBD oil, but that actually seems to have no effect on eye pressure. So it's not really a great treatment. Exercise, on the other hand, is very good at lowering eye pressure. This is a study that we are doing right now, which really surprised us. After a single period on the bike, we found that people who were not on treatment actually had their eye pressure go down 5 points after 5 minutes. So it lowered their eye pressure right away. And what we were especially surprised by is that we took people who were already on eye drops for their treatment, and their pressure also went down. So even on people who were treated, we saw a lowering of eye pressure. We're not the only ones who showed this. This is an old study that was done quite a while ago, where they took people who were sedentary, not on treatment, and they had them exercise for 12 weeks, and you can see their pressure went down quite a bit in that middle graph. And then it went right back up after they stopped exercising. So unfortunately, it's something which does work, but you have to keep on doing it for forever for it to work. It's not always that obvious how something works in terms of your eye pressure. For something like caffeine, for example, a lot of caffeine seems to increase your eye pressure if you have a high genetic risk, but if you don't have a high genetic risk, it doesn't seem to have an effect. So it's not that easy to understand maybe how coffee might affect you or not. Meditation is another thing which has been shown to be very effective in lowering eye pressure. Even on patients on medication, Tanuj Datta, a glaucoma specialist in India, has shown that after 3 weeks of in-person meditation sessions, he noticed a very significant drop in eye pressure. And I've seen this in a few of my patients as well, and it's really surprised me. What about the changes that are occurring in your body as a result of some of these interventions? Exercise, I think, is well known to change many things in your body. One thing that's been shown directly in the retina by another group is that it actually improves how much blood is flowing through the retinal tissue and how much the tissue is being perfused after an 8-week session of exercising. These are not people with glaucoma, but we assume that similar things happen in older adults with glaucoma. We know that exercise improves the function of the mitochondria, which are the powerhouse of your cells and which provide energy within the cells. And a lot of people have suggested that mitochondrial disease and mitochondrial dysfunction may play into glaucoma, and some of the treatments that were mentioned, such as nicotinamide, actually are meant to actually provide extra energy to your cells. And so when you can simply improve the function of the energetics of the eye and the retinal ganglion cells through behaviors such as exercise, you may be able to get some of the same effects. In Dr. Datta's study of meditation, he found that there were a number of things within the body that changed after 3 weeks of meditation, including the eye pressure, some of the growth factors within the eye, many inflammatory markers within the blood. So there were a number of things that suggested about why this is working. So it's not kind of a voodoo type response. It's actually something which is changing your body in ways that may actually benefit you. Well, to what extent do we know that these things prevent glaucoma or not? We've done a bunch of studies on physical activity, and we found that individuals who had worse glaucoma were less physically active. You can see the number of steps here by how bad the disease is, and the people who have less disease seem to be more physically active. Of course, you don't know which one of these came first, but in a subsequent study, we actually looked at whether people who did less activity seemed to maintain their vision better than people who did more activity. And what we found is that people who were more active seemed to lose less vision over time. It wasn't a very dramatic effect, but it was you can prevent about 10% of the worsening that you're going to get by living a more active lifestyle, say, walking 10,000 steps a day instead of 5,000 steps a day. With caffeine drinking, again, there's a similar association here that there was a higher risk of glaucoma, but again, not in everybody, only in those with high genetic risk. So I think when you're trying to think about whether you should change your behaviors, it's also sometimes helpful to really discuss it with your doctor to see whether that specific change is something which is going to be realistic for you. Healthy eating is something that we get asked all the time, and unfortunately, there's not a lot of great evidence on this. There's some evidence that glaucoma occurs less in people who eat a lot of green leafy vegetables. So things that, like the lunch we had today, I think was probably a very good lunch for glaucoma. But there's little evidence that specific foods really protect against glaucoma. So when you talk about what you should do, I think you should obey the obvious, but not necessarily go overboard with it. It's not also clear that poor weight or having a cardiovascularly unhealthy lifestyle worsens glaucoma, though it may. I think in general, when you're making lifestyle changes, you want to do changes that make you more healthy. Exercise is something which really helps a lot of aspects of our life and well-being. People have shown that you can cut down a significant amount of heart disease, cancer, diabetes, and mortality just by simply being more healthy. And about 5 to 10% of all these major diseases occur because of sedentary activity. Likewise, the effects of meditation are broad and can influence a number of different conditions as well. So you're probably likely to have many other secondary effects. There's really not enough evidence to tell you how to eat, as I mentioned, so I think I would obey the obvious. Avoid processed foods, avoid simple sugars, and eat a balanced diet. When you think about, well, how am I going to make these changes, and am I going to make these changes? This is one book that I really like as kind of a motivational book for change, and there's certainly many of these, so you can pick the one that you like the best. this is one that kind of talks about the Japanese method of continuous improvement through engagement and small change. And so, you don't want to become the 33-minute, 10K runner tomorrow. I would start by picking something small. Oftentimes it's fear and inertia, which really holds us back. So, aim big, but start small, and then just keep at it. Thank you.